United States, 1 in 17 people will develop colorectal cancer. The disease is the second most common cancer in U.S. women of Hispanic, American Indian, Alaska Native, Asian, or Pacific Islander ancestry. It's the third most common cancer in white and African American women. If left untreated, these cancers grow and eventually spread through the colon wall to involve the lymph nodes and other organs. According to the Centers for Disease Control and Prevention, roughly 1/3 of the country's eligible adults haven't been screened for colorectal cancer, as recommended by the U.S. Preventative Services Task Force. As the specialists at Advanced Gastroenterology and Surgery Associates point out, colon cancer screening is vital.
Colonoscopy screening is extremely important, and I think it's important to note that colon cancer is the second most common cause of cancer death in the country, and the third most common cause of cancer in men and women.
Why do we do colonoscopy is to look for any type of pathology or condition in the colon, such as, and they can be as benign as internal hemorrhoids, pockets in the colon called diverticulosis, as well as polyps, and any kind of lesion that can either be biopsy or removed. Also, there are conditions, for example, people may come in with bowel habit change, such as having diarrhea and whatnot, and colonoscopies will be done then at that point in time to obtain a pathologic diagnosis by removing tissue samples and looking under the microscope. And so colonoscopies are very, very important. First, right off the bat, why? Is because it's very important for being able to detect malignancy. That's the most important thing, and colon cancer is very preventable if we are able to diagnose it before it gets there. And it just so happens that a person does have colon cancer if it's small enough and is not and it has not spread, then it's treatable by surgery.
Most patients after the procedure, after having had a colonoscopy, would say it wasn't as bad as I thought. The bad part is the preparation, the day before. We have to cleanse the colon. The colon has to be clean. The cleaner the colon, the better we see. Because we're humans, we can miss things. The colon has a lot of folds, and there's a lot of spasm, so you can actually miss small polyps. So there's always a potential miss rate for colon screening. So the preparation is very important. Unfortunately, the prep is not tasty. And there's a reason for that. When we cleanse the colon, you lose a lot of electrolytes. So the bad taste in the preparation is really from the electrolyte replacement in the solution. The actual procedure itself is relatively benign. Patients are sedated, either with moderate sedation or some even with general anesthesia. So the vast majority of patients don't recall the procedure or have any problems with it.
For more information, as well as the testing and treatment options offered at Advanced Gastroenterology and Surgery Associates, please click on the Vital Screening Story link icon on our homepage, yourhometownhealth.com.